everything okay?
No, not exactly. I've just lost a patient.
Oh, okay, listen, Greg, I don't think we should make too much fuss about this. You know, I don't want to upset the other patients.
No, not lost a patient like that. No, a young girl, about 15 or so, just came into my consulting room, muttered something completely incoherent, and disappeared. You haven't seen her, have you?
Oh, yeah, her. She left in a hurry. It must be your fatal charm, you know. Still, there's plenty more to choose from. Would you like to pick one?
Hi, can you put me through to the maternity unit, please? Hi, is Shirley there? Okay, thanks. I'll call back later. Hi. Come in.
The pain's getting worse, Dr. Kendrick. I've not known it as bad as this before. It's right across my chest, like a tight band.
And this began about an hour ago, you say?
About that, Doctor. Though I wasn't checking the time, so it could have been more than that. To tell you the truth, I was too frightened by it to do anything more than call you.
You did the right thing, Doris. And there's no reason to be frightened now. I think you should be in hospital.
I think so, too.
Dad really likes you, you know. I mean, better than anyone else he's met. Okay, they didn't come out quite how I meant. But he really does, Faith. I've not seen him this happy in a long time.
Look, Colette, I've got another patient to see before lunch, and I'm not sure I should be discussing this with you, so...
Please, Faith, it won't take a second. Look, I know what happened with Lex, and I'm sorry. He can be a pain sometimes.
I don't agree with that.
But he's just a kid.
Yeah, you're right. He is just a kid. No doubt he'll improve with age.
Oh, he will, I promise. I used to be a pain too, but I grew up a bit. I was always flying off at the deep end.
I guess that's what age does for you.
Yeah. Are you okay?
I feel like I've been a bit of a fool.
You? If anyone's been a fool, it's Lex.
My reaction to Lex was a bit over the top.
But very understandable, believe me.
I should have known better. You're right, Colette. Age should make us deal with problems in a more rational way.
So, you'll give Dad another chance?
Colette, I know you mean well, but I've only been out with your dad on a couple of dates, and I feel like his whole family's involved. It's feeling a bit crowded.
So it's not Dad? It's not actually him you don't like? I understand.
You do?
Look, leave it to me. We'll back off. I'll deal with Lex. And you'll speak to Dad, yeah?
It's Doris Jenkins, 75 years old. She has severe angina, which has led, I believe, to a severe heart attack this morning. A&E are expecting her. You're going to be fine, Doris. You're in very good hands. Thanks. Look after her.
Oh, what a day. I was glad to see the back of them all.
Yeah, me too. So, you fancy a nice, relaxing lunch?
I do.
Okay, I'll round out the others, shall I?
Actually, I think most of them gone ahead already.
Couldn't wait to get away, eh?
Yeah, something like that. I've got a couple of things I've got to finish off, okay?
Yeah, me too. I'll see you back here in 5 minutes. Look, as it's just us, should we have something a bit special?
Yeah. Mac! Mac!
You said everybody had gone.
I thought they had.
Well, somebody has left something very important.
Oh, they probably haven't. I think we'd better have a look round, see who I've locked in. Come to think of it, I don't remember seeing Greg leave either.
I'll check his room.
Okay. Is there anyone in here? Hello? Well, I can't find anyone.
Nor me, and I've checked every room. Oh, she looks fine, as far as I can tell without disturbing her.
Let's have a look what we've got in here. Oh, sweet. Lunch?
Her name is Tamsin. She's 7 months old. Please, would the doctors at the surgery take good care of Tamsin? She is 7 months old, and find her a loving home. My father's coming home from abroad later today, and he doesn't know anything about her. He'll never accept her because she's illegitimate. She can't stay with me. He'll go mad. Nothing to identify the mother.
You know, this looks like a young person's writing. It's tear-stained as well. Poor little thing.
2 poor little things. Look at that. Obviously heartbroken.
Well, I better go and phone social services and the police.
What? Oh, yeah, I'll check her over.
I'm really sorry about the way Lex behaved.
Forget it. I have.
That's good of you. I know he can be hard work sometimes.
He's at a difficult age, and we didn't get off to a good start.
His fault, not yours.
Maybe. I would like to get to know him better.
Would you? Brave as well as beautiful.
Not really. Just one of life's optimists.
Well, he does improve on contact. And while I'm apologising for my kids, I'm sorry Colette came to see you the way she did. She shouldn't have done it.
I'm sure she meant it for the best.
Definitely. That's Colette all over, doing things for the best. I was going to get in touch, you know. I just wanted to leave it for a few days. Colette shouldn't have tried to rush you.
It doesn't matter. In fact, it's probably a good thing she came. She gave me something to think about. Helped me get a few things in perspective.
What sort of things?
Right.
What do they say?
Police and social services are on their way, but there's been a very bad car accident held back at traffic that could be quite a while. So, my little Tamsin, we are just going to have to wait until we find your mummy, aren't we?
Well, I've checked her and she's fine. She's been very well cared for.
You knew something, Mac. It would look a lot better for the mother if she turned up before the authorities did.
Yeah, I agree. Especially as she's probably regretting it by now.
What are you doing?
Teenage girls, we must have had something today, haven't we?
Yeah, more than likely.
Ah, Sally Compton. No, there's no way that she could have had a baby in the last 7 months.
I tell you what. Would you just call up Greg's patient list for this morning?
Greg's? Why Greg's?
Well, he was talking about a teenage girl that was behaving strangely.
Really?
Let's have a look.
Ah, it's more like it. Trudy Layton, age 15, and she lives just around the corner. That's handy.
Yeah, she had the 1:20 appointment. Hang on, let's just call up her records. Yeah, there you are. I see he's mentioned her behaviour in the notes there. Where are you going?
Well, she said that her dad would go mad, right? How much madder is he going to go if he comes home to find an army of social workers and 2 police officers waiting for him? She needs support, and she will get support.
I'm not saying that she doesn't.
No, but you're absolutely right. You're absolutely right. She needs to show up before the authorities actually arrive. She can say that it was a moment of stress rather than a deliberate abandonment of her child.
Yeah.
Okay, I'll be back when I've found her.
Okay. So, little miss, what are we going to do now? Come on.
Having a relationship with someone who already has kids, it adds an awful lot of stress and strain, Rob.
So that's it. I come with baggage.
I wasn't going to be that crude.
Just telling it like it is.
Kids add complications, resentment sometimes. It's to be understood. I don't blame them for
There's
it.
no resentment on Colette's part. It's just the opposite. And if you're thinking of Lex, you said you wanted to get to know him better.
Yeah, I would, but...
Just be thankful they're not toddlers. They bring worse things than resentment. Try dirty nappies. And they want to get up at the crack of dawn as if they've been to bed in the first place.
Rob, listen to me.
The best thing about teenagers is they really want to get up at all. So it's not me then. Me you don't like, I mean.
I like you, and I like your kids.
What, even Lex?
Even Lex.
So what is it then? What's stopping us if we like each other?
It's not just you that comes with baggage, Rob.
Jerry.
You Trudy?
Yeah.
I'm Dr. McGuire from the Mill Health
I know
Centre.
who you are. I've seen you before at the medical centre. What do you want?
Well, you must know why I'm here.
You shouldn't have come here. My dad's going to kill me if he finds out.
Well, it's hardly something you can keep a secret, is it?
Why not? Loads of people do it. It's not as if I have to show it to anyone if I don't want to.
It? Is that any way to talk?
I could talk about it how I like. It's mine.
Trudy, social services and police did have to be told, but you can minimise the consequences if you come forward now, yeah? Before your dad finds out?
The police and social services.
Look, I'm really sorry, but we do have to follow certain procedures, you see.
But it's not that bad.
Well, of course it's that bad.
I didn't think it was against the law or anything if I wasn't 16. I just knew my dad would kill me if he knew I'd had it done, and he hates them.
Hates what?
It's my belly button piercing. I had it done a few days ago and it's got infected. I need it sorting out.
So why did you run off this morning?
I was too embarrassed to show it to that young dishy doctor, wasn't I?
Ah.
How could I? It's awful. And it stinks.
Does it?
I wanted a woman doctor or someone old, like you, but they're all booked up. You won't tell my dad, will you, Dr. McGuire?
Trudy, I may be old, but I do still remember what confidentiality means. Come to evening surgery and ask for me, yeah? I'll see you there. Julia? Oh, there you are.
Where's Trudy?
She was the wrong one.
Oh, dear. Listen, Dime, could you do the honours, please? I've got my hands full at the moment.
Yeah, of course. You're losing your touch. There was a time when you could juggle babies and nappies.
Well, trust me, I could have dropped one if I tried. What's that?
Chill receipt at Bar's Mini Marts. Oh, yeah, I know it. On the edge of the Benson estate.
Benson?
Uh-huh.
Most people on the Benson are with the East Side Clinic.
Yeah, right. Well, this certainly simplifies things, doesn't it?
How does it simplify things?
Well, the Benson estate's very small. Bound to be somebody here who can help. I'll take a stroll down there.
Oh, you take a stroll down there, will you?
Yeah, why not?
Ah, and leave me here to babysit?
Not at all. No, no. You grab yourself a sandwich. I'll take her with me. Well, fractious baby. You could do with a walk, couldn't you? Of course you could. Come on. You open the door, please.
Certainly.
Thank you very much. We're going for a walk. We are going for a walk.
You must think I'm really mixed up.
You lost your husband. You're allowed to be mixed up.
Yeah, I know. But I'm not. I just needed some time to think, to sort things out in my own mind.
I understand. And, I mean, you did say you weren't sure if you were ready after Jerry.
And when I said it, I thought it was true.
but not anymore.
I think Jerry would have wanted me to move on. I want to move on. I think it's the right time.
You sure?
Very. I think it's time for me to rebuild my life. And I would like you to be a part of it. If that's what you still want.
Tamsin. So how's my favorite little customer then, huh?
You know each other?
Oh, yes. Yes, sweetheart.
Hello? They've done what? Sent Doris home? Why? But she's had a heart attack. I don't believe this. When did she ring? All right, I'm gonna pop round.
You're looking after Tamsin today.
Well, I'm just helping out.
Oh, that's very good of you.
Well, you have to do what you can if there's a baby in the family, don't you, eh? Always on the go.
I know. I've got two of my own.
Uh-huh.
You must be Uncle Peter then.
Yes, yes, that's right. Two, you say, so you know exactly what it's like, eh? Never a moment to call your own. Do your kids ever play with Tamsin? I mean, do they go to the same playgroup or something?
No, mine are older, at the primary school. But they were never as well behaved as you were there, sweetheart. She's as good as gold, you know.
So I'm told. Well, she's going to need feeding. I better get back. Don't want to make her late for it.
No, good she might be, but she can cause ructions when she's hungry. Huh?
Like all kids.
Exactly. You're on your way home?
Yes, I don't like to keep around too long.
Good. That's useful, huh?
Useful?
It's just that Mrs. Moores lives in Midland House, too.
Mrs. Moores? I don't think I know Mrs. Moores.
Well, the very elderly lady who lives next door to Tamsin.
Ah.
You know, she doesn't go out much now. She's afraid of muggers. She's at number 42. I've told her there's no need to be afraid in this area. It's a very safe estate, but she won't listen.
Huh.
Ah, well, that's old people for you, set in their ways. Huh?
Yeah, absolutely. So what's the favour I can do? How
Well,
can I...
if you're going that way, you could save me a trip, if you don't mind.
No, I don't mind at all. 42, you
Thank
said?
you. 32.
Okay.
Thank you.
Bye-bye.
Bye-bye.
Bye.
Bye-bye, Tamsin.
I don't understand this, Doctor.
Try not to get upset, Doris. It won't do any good. Now, just tell me again what they said.
Well, they left me in accident and emergency for a bit, and then they came to examine me. There were 3 of them. I think 2 were students, from the way the older one was talking.
Do you remember the name of the doctor that examined you?
No. Well, he did tell me, but I've forgotten. I couldn't take it all in.
Don't worry, I'll find out. Please go on.
He asked me my symptoms and made some notes. And then he said I was suffering from indigestion.
Indigestion?
Heartburn, he said, but I know the difference, Doctor. I've had heartburn more times than I can count. This was different.
Please don't worry yourself, Doris. It won't help.
I know, but I'm so tired of this, Dr. Kendrick. It's been going on for months now. I don't know what to do.
I know this isn't easy for you, Doris, but I promise I will do everything I can.
I'm not important enough.
No one said that.
Yes, but it's the way it looks. I can see it in their faces. They think I'm a silly old woman making a fuss about nothing.
Mrs. Moores, I've just brought the tea up from the grocer's. It's the right one this time.
Okay.
Look, I just brought Tamsin back. You wouldn't know if her mum's back yet, would you?
No, sorry.
But you've done nothing. Nothing to treat her. I'm sorry, I totally disagree. I can't imagine what you were thinking sending her home in her condition. Who's her consultant?
What are you doing?
What does it look like? You shouldn't have brought her here. I don't want her.
Really?
Why would I want a baby?
Because you're her father.
So? Doesn't mean I want her.
Well, I think you do want her.
Just get her out of here.
What's the hurry, John?
Got things to do. I meet mates and stuff.
Meet your mates.
Yeah? Why not? It's what people do when they're 16. Don't hang around with stupid babies. Now take her away. I don't want her. I said take her away. Are you stupid? Got to understand. I don't want her.
No, well, I can see that you don't want it. Why did you abandon her at the health centre?
Thought she'd be safer there. And you lot being doctors, look after her properly, find her a good home.
No, well, that's not quite what I meant. Why did you abandon her when it's very obvious that you love her? And you have done a fantastic job looking after her. Where's her mum?
I don't know. She left ages ago when Tamsin was 3 weeks old.
Think she'll come back?
No. She was like me, 16. She didn't want a baby. Neither of us wanted a baby. It just happened, you know?
Yeah, I know.
Annie, Tamsin's mum, she tried with her, but she just couldn't hack it. I got up one morning, she was gone. There was a note, and that was it. She won't be coming back.
So you've been doing all this on your own? Who's Uncle Peter?
Uncle Peter?
Yeah, the bloke at the minimart thought I was Uncle Peter. Well, can't he help?
He doesn't exist. I told Mr. Khan that so he wouldn't get suspicious of me being held my own with her.
Oh, right.
You have to understand. You have to take her away. Did you feed her? I'd left the bottle made up.
Yeah, my wife gave it to her.
That was nice of her.
Why did she have to go, John?
This isn't my flat. I'm too young for tenancy.
And that's it?
My dad rents this place. He won't have her here. He's in the Gulf. And he's been in the forces. Took this place on a few years ago for me and Mum.
Yeah, where is your mum?
She died 15 months ago.
Oh, I'm sorry.
I was doing really well at school, you see. Really well. And Dad's got this thing about education. He says education's everything. You do one education, you do one in life.
It may have a point.
Dad likes to make a lot of points. With the belt or the strap, if you get what I mean.
Yes, I get what you mean.
Spare the rod and spoil the child is his favourite saying. He has no idea I haven't been to school in months. I mean, how can I? There's no one to look after Tamsin, and child benefit doesn't go very far.
You're sure your dad won't accept Tamsin?
He'll hate her.
Oh, come on.
You don't know him.
Why don't you just take Tamsin and go?
Go where? There's lots of help for teenage mums, but there's no help for me. It's like I'm invisible. No one thinks about us. There's a hostel on the high street that takes young girls and their babies. How do I get them to take me and Tamsin? They'll take her away.
Why would they?
I left her.
Yeah, in a moment of desperation. You're not the first parent to leave a child.
I'm not old enough. They wouldn't let me keep her.
You're her father, and you both need a place of safety. What alternative do you have if you want to keep her?
I'm not 17 for another month. Don't I still have to do what my dad says?
Listen. If you're a minor at risk of violence or abuse from an adult, then you have a right to protection. You also have a right to support in bringing up your child, the same as any other young single parent.
You think so?
I know so. But it's not going to happen unless you talk to the right people.
They'll see that I looked after her properly, won't they?
There's no doubt about that. I can call social services now. Your choice.
You'll stay, won't you, Doctor? Just until someone comes. I don't want to be here on my own with her when he gets back.
Now, well, I'll do better than that. I'll run into the hostel. So now, do I ring social services? Let them know we're on our way?
Do it quickly, please.
Yeah.
Hiya.
Hello, Doctor.
Thanks.
Well, thanks for doing this, Dr. Maguire. For talking to them. I couldn't have done it without you.
You look after yourself, John, yeah?
I will.
Next on BBC One, a nurse with a habit of losing patients is labelled a serial killer in Murder, She Wrote. And later, Britain's Shelley Rudman is in a good position for a medal in the women's skeleton at the Winter Olympics. Coverage of her final at the Games on BBC 2 from 5:15.